There's so many electrologists in the state of Florida. Minimal supervision. Like, these are just electrologists who have their own suites out there. And they're performing tattoo removal, laser-based tattoo removal.
And they don't have a medical director or anything,
And,
right?
you know, there's no regulation, right? And tattoo removal doesn't fall under the Board of Electrology. It falls under the Board of Medicine.
You see so many people with partial tattoo removals where they've gone for like 10 or 11 sessions and it still looks like crap. Welcome to Inside Out. More McDonald's.
The McDonald's statistic, is that what you're talking about right now?
Yeah.
So there are officially more med spas in the state of Florida, almost in the country, than McDonald's. There's actually almost triple the amount of med spas as there are McDonald's in the state of
Who would
Florida.
have thought?
Isn't that insane?
That's a statistic nobody realizes is possible in the state of Florida.
And when you think about the barrier to entry to actually get into the industry, I don't think, and we talked about this, med spa is no longer an adequate word to describe what we do.
That's right. It's way more complicated than that.
Spa med?
No?
You don't think we should just reverse it?
Spa med? No. No, I think, it started out Botox and fillers, and then a lot of them had estheticians, I guess, that did facials, and then it expanded to include weight loss, then hormone replacement, then some wellness services, then obviously laser became a big portion, body contouring, magnetic muscle stimulation devices, IV therapy.
It continues.
It continues constantly.
You know what's crazy is Joe, my Groupon agent. I'm a believer in Groupon. You know that. I think it's great. They have a massive outreach. They're a public company. They're very reputable. If you do a one per client, you know, just to show what actual services should be like, not bad services, and like you have a bad rep with everything. He told me, he's like, listen, you can't. There can't be any more facial Groupons because it's so saturated. Like, it's confusing consumers because, like, I guess the amount of estheticians that came into the industry and were just like, facial Groupon, come get whatever, and it went crazy. And so they cut off facial campaigns because of that.
Even for like well-established med spas and stuff?
No, just for like newer clients, I guess, rolling forward. They wouldn't do it anymore.
Well, they wouldn't do a weight loss campaign for me,
but
because it was so common.
Yeah, but the thing with that was I think it was more the legalities of the big pharmaceutical companies and the compounding pharmacies, and making sure they couldn't fact check whether it was being done by a licensed provider. Like, they don't have a medical team, you know. So it's like,
but even though they did know there was a licensed medical provider there, they still wouldn't do it.
But it's like, I can kind of give them the benefit of the doubt with it.
Yeah.
Well, it's like, I don't have a Groupon for weight loss, right?
I thought you used to.
I did, and it performed very well because we've talked about this, where clients came in, they saw the right experience, right? So they never got off the medication, and if they did and they went somewhere else for medication, they came back because it wasn't the same level of service and it wasn't the same level of expertise. But there's so much that's, you know, unregulated, and I think they were just like, screw this, we don't want any liabilities. It's not.
So they're not doing weight loss campaigns
for anyone. Yeah,
Oh.
I just think it was a legal move. It was a legal decision that they were just like, no.
It's funny, they're the only game in town.
You know, they bought that other one, but left it the
Long
same
time
company,
ago.
Living Social. So because people,
does anyone even use Living Social anymore?
I don't know, but they bought it and they left it. Let's talk about a monopoly, right?
Yeah.
They bought it and left it Living Social just because people they would call and like, hey, I have a Living Social voucher. I'm like, what is that? You know, when I was first hearing about that.
Yeah.
And I guess Groupon acquired them, and
long time ago though.
Yeah,
like
very
10
long.
years ago.
Groupon really owns their coupon industry.
There's no competition.
How could you compete with that though? Like, what do you even do?
But do you remember when Groupon started? It's
Yeah.
interesting.
Yeah.
And there was about 10 other companies like that, and that started copying their model, and they just went out and bought every single one of them up.
It just shows you what the right CEO and the right team do. Like, they had the right business. Kudos to them. Like, did the right business, the right employees, the right team, and they dominated because of that. And I think, you know, at some point there will be a similar effect to where there's so much saturation in our industry that it starts to fall off.
Yeah, and one of those precipitators could be a recession.
Yeah, you see the housing market stuff and all that going on. I mean, you never know. Everyone
I
analyzes
hope
everything.
not,
Yeah,
but yeah, usually that's what filters out all the.
over leveraged, um, even overvalued, right? You have a lot of individuals who own clinics, right? And it's like, okay, you've got 10 million coming in a year, right?
And they got a ton of overhead
And they've
though.
got 10 million in costs.
Yeah.
And it's like you're working your butt off just to stay afloat, right? I mean, I tell you all the time, like with scaling and the new locations, like if it's not managed perfectly, like we have a ton of operating costs, like especially with the Vero Beach location, the new tattoo devices, the hyperbarics, like all that is overhead. It's a significant investment. Even with it having no interest, like I mean, these are big assets, right? And hiring and development and marketing and all this sort of stuff. If it's not managed properly, I mean, you're
Well,
doomed.
coming from like medical side, where a lot of doctors' offices ended up becoming hospital owned and hospital managed. I mean, it's because medical doctors are not necessarily business people, and almost every doctor that went out of the mall, what went out on their own or started up as a small group, they all had way too much overhead. They couldn't make it,
And you're
and
you're
they all the hospitals acquired them.
you're definitely an outlier in that scenario, right? But that also follows with reputation and patient respect and retention and
Yeah,
you've
partially, but I mean, when you're dealing with insurance-based, businesses,
even cash
even if you have
though.
a great reputation and stuff, etc., I mean, you still can only see so many patients a day, and you can still only get so much money from the insurance companies. So, I mean, and then there's the doctors that really do care, and they spend the extra time with each patient, and then there's the doctors that will they'll spend 3 to 5 minutes with each patient, so they get maximum amount of reimbursement. So, I mean, obviously, the better doctor in that case gets paid less. So that's not a good example.
You know, I want to backtrack a little bit real quick because of the acquire of the tattoo devices, the Toro. Uh, there's so many electrologists in the state of Florida. No, like minimal supervision. Like these are just electrologists who have their own suites out there, small little suites, like doing well with laser hair
Oh, there's
removal,
so many of those
and
that,
they're performing tattoo removal, laser-based tattoo removal.
and they don't have a medical director or anything,
And
right?
I guess it could be gray. Like there's no regulation, right? And tattoo removal doesn't fall under the Board of Electrology. It falls under the Board of Medicine. So then it's like either go ask, knock on the door, and get the accurate information. But um, I see it everywhere, and I'm like, you're not worried about the compliance or the safety or the patient outcome of that. Even if you think you're trained enough by the company, you need to have someone there to assist if an infection or um,
A severe burn.
yes,
Yeah,
it's important. I find it weird, no?
it's very weird. I mean, there's a lot of things that can go wrong with tattoo removal, and the very least of which is just an inadequate result. You see so many people with partial tattoo removals where they've gone for like 10 or 11 sessions and still looks like crap. So, I mean, it's a very difficult science to get correct, and you need the latest technology to really do it well. And even if all of that is true, you still run the risk of burning the patient. You run the risk of severe pain with the procedure, and also inadequate follow up. So it's just there's a lot of things that can go wrong with tattoo removal, and that's not even getting into people that have died from lidocaine toxicity.
You know,
Have you
it's
ever had? Do you have people go out with lidocaine like topicals, and they put like Saran wrap around their legs to prepare for like a tattoo removal or anything like that,
well, we will do
or
that for
hair removal?
not for hair removal, no, right? Because it's got cryogen
Hmm.
infused. Uh, for the more aggressive ablative procedures like the DECA, yeah,
So
definitely.
are they recommending that now?
Who?
The company.
I don't know what they're no they
Like just as preparation for the procedure.
I mean, they always want some sort of topical numbing on there, but I think majority of the clinics that use a topical numbing, it's not a successful compound. Like it's a BS compound. It doesn't do well with penetrating the skin. Like they're not massaging it into the face. Our numbing cream's pretty advanced. I mean, but like when I do a cooler stuff and I numb, I have an allergic reaction to it every time. Like my skin fully.
Oh, there's a lot of people that have
My skin fully
allergy to
flares
it.
up, but I trust the provider, so it's a little bit different. I'm sure you can go to 101 practices and they've got no idea about any of this, but there are a lot of clinics out there that know what they're doing. Speaking of that, people are gonna hate me for this, but I think we could both agree that an MP or a PA coming out of school, should they be allowed to inject Botox right out of school?
I mean, even some doctors shouldn't be
Yes,
allowed.
yes, right. So a medical profession coming out of school, should you just be allowed to inject or administer aesthetic medicine?
It's the problem with the industry. There's really no threshold to performing these procedures. There's no licensure requirements. There's no certification requirements. It's all a very gray area. And, these online or 1 hour, 2 hour courses you can take in person.
That are like $1,000.
Yeah.
You're paying $1,000 for pretty much, and there are some good courses, but it's very minimal, and they're not explaining the legitimate risks that can happen with these procedures, as well as all these statistics out there. 10,000 hours to be a perfectionist at your craft, right? So you think a 4-hour Botox course that says you're certified in administering neuromodulators
doesn't mean anything.
Is going to mean
It's just
anything?
a piece of paper. It doesn't mean anything whatsoever. I guess it's just to make the provider that paid for the course feel good about themselves. But I mean, the only way to become competent at any of this is to do it repeatedly over and over and over again under the supervision of someone that really has adequate experience.
So I think we should put this out there, and if you're an individual watching this and you could help shed some light on this, what should happen is there should be a board of individuals, whether PA, NP, MD, that have a massive understanding in aesthetic and regenerative medicine, and even electrology, right? Same thing goes for electrology, because there's serious burns out there with laser hair removal right now. Those individuals should sign off on recent graduates of their school after a internship program or fellowship of like at least 100 hours, right? Get 100 hours under your belt before you go inject someone with a neuromodulator or derma filler or anything.
Mm-hmm.
What's your take on that?
Yeah, I think there definitely should be some kind of continuing education requirement, certainly an educational requirement that consists of a certain number of hours that are required, experiential hours and supervision, and a doctor that signs off on that supervision and training and to receive some kind of legitimate credential to inject.
In aesthetic medicine or regenerative medicine or...
Well, if you're talking about wellness or like a longevity or what they used to call anti-aging medicine, A4M is one of the big pioneers in that field, but they've never been fully embraced by the board of medicine.
Why?
I don't know.
But I'm gonna be.
I guess maybe because
hold on, I'm gonna be the devil's advocate here, and you might not agree with me on this, but I'm gonna be an advocate for the mid levels. I think there are definitely some PAs and NPs out there that are more educated in aesthetic medicine than MDs.
Of course there are, without a doubt.
So at that point, right, you obtain a license. You go through residency, you go through, your required schooling, whether it was NP school, PA school, MD, DO. How would you even put together a compliance regulatory board like that? What would be the next step?
I think you would need
federal or state? Is it
there's
federally
really
regulated?
no federal regulation of medicine anyways. Yeah, it's all state regulated.
I know, but so here's the thing, though. Traditionally, you get sick, you go see a doctor, right? That's traditional. If it's very advanced, you go to a hospital. Then urgent cares came about. You no longer want to go to a hospital. You can go see an individual at an urgent care, right?
I don't think anybody should go to urgent care.
But then that was the new
Yeah.
thing. MD now urgent care. You know, some of the hospitals had branches that where they
Well, I
they
think
had these.
what used to be or is still now in practice in some hospitals, they'll have two levels of care for emergency medicine. They'll have like non-urgent and urgent care, and that usually give much better treatment and much better uh, physician experience at those types of places. But these urgent cares are not adequate.
I never looked into it, but I don't think there'd be. I mean, like I could probably own an urgent care. Like I don't think it has to be physician owned.
I don't think so.
So I mean, I think any individual could go own an urgent care, right?
I mean, it's interesting. I don't know if we ever looked at the statistics on urgent cares, but there's probably more urgent cares in the state of Florida than anywhere else.
We can look it up, but
because they're everywhere.
I mean, if we really break it down, there was not there even with the urgent cares, there still wasn't a big boom, and like where there was so much desire in a medical related realm. Like unless you're doing like cosmetic dentistry, plastic surgery, right? But you need a higher income of a lot higher of an income individual to go do veneers or have a plastic surgery operation, right? So that was, more barrier of entry there. It's a little bit harder. You have to for a patient, but it seems so easy to open up a little tiny med spa suite.
Yeah.
And that's why I feel like there's a need for a board like this, right? Because it's a big boom. It's a big oversaturated market, and the knowledge falls on the patient now because patients have to have a decent understanding of where they're going in the industry. Like because they have so many options.
Yeah. There should definitely be a secondary educational requirement for all these medical spa related services. Because it's just kind of a fly by the seat of your pants type of situation now.
Yeah, I mean it's absolutely insane. I'm pulling up this stat real quick. How many urgent cares in Florida, and we'll see what we got going on here. So there's 1,000 urgent care centers in Florida, which includes 694 independent clinics and 381 are hospital affiliated. So over 60% of the urgent cares are independent. And only 30%, 38% are hospital affiliated, right? Let's see if do you need to be a doctor to own an urgent care? Because
I thought there was some ownership requirement for medical spas, but there isn't, is there?
You don't need to be an MD to own an urgent care. Some states allow non-physicians to own facilities. I mean, what's crazy though? You have to be a lawyer to own a law firm.
Practice.
Yeah, you can't. Morgan & Morgan is a massive company, right? They dominated the legal industry from a malpractice and an personal injury based law side of law. And I mean, you'd think a company like that would go public, and you can't because you have to be a lawyer to own a law firm.
Yeah, it doesn't make sense.
I think to own a med spa, to own a med spa, I think there should be a doctor involved. Doctor should obtain ownership. Like you shouldn't be allowed to have a med spa unless it's by. But then we're contraindicating because we just both said that there's PAs and NPs out there that are more advanced than some MDs.
But I mean that's the exception, I think, more than the rule. Obviously, I mean there's a higher criteria to become a doctor. And with that comes some sense of responsibility and medical oversight that is not necessarily part of the culture of a nurse practitioner or PA.
Yeah, but let's just break this down real quick and talk about Jen. 18 years of experience.
But Jen's not like she is the exception. She's not like the rule.
Correct. So you have individuals out there that Jen's dedicated her whole life to aesthetic medicine, right?
But the same thing could be said of a PA that works in an emergency department or a PA that has been doing assisting with surgeries for
Yeah, but do you know
20
what the
years, you
reason
know?
with that is? Is a PA doesn't, or I'm not speaking on all PAs, but probably majority of the PAs don't have the funds to go start a hospital, right? The
Hmm.
barrier to entry is a lot harder. The barrier to entry to own a med
That's
spa
true.
is, and that's why I'm saying separate it, right? You've got
Well, and also you'll never
this.
have a PA as the primary person performing the surgery. I mean, that just doesn't happen. They're always going to be assisting.
Correct. But
But
MPs
in
can
but
own
in
a
medical
primary
spa,
practice.
yeah,
You can be an MP and own a
that's
primary.
right.
You can be an MP and own a primary practice. I don't even think you need supervision to do it.
I don't think so either.
Right. So I think, when they were writing these regulations, they were writing them with good intent, but the industry has developed in something that wasn't anticipated, couldn't have been predicted. And now it's like it needs to be combated. And it's the same thing with the opioid crisis. Like they didn't know that was going to happen. And then they had to kind of put their foot down, right?
Well, I think that law you're talking about with regards to nurse practitioners and PAs operating a clinic independent of a medical director, that came about during the pandemic.
Well, you said that it became a little bit more lax after COVID hit,
Hmm.
right? In terms of telehealth.
Yeah, and then I think that expanded some of the duties and the oversight of nurse practitioners and PAs. They were given more responsibility and less oversight as a result of the need for more medical personnel.
Well, I mean, there's gonna be like corruption in any industry. You mind if we bring up your accountant? I mean, was not he was just lazy or
Yeah,
unintelligent or like, you have someone who you trust to, keep your books correct and they don't do it right.
yeah, they don't
Right, and
do
that's
the
in a my
bookkeeping
my whole
right.
example with that is when it's in a completely different field, right? I mean, you have to take your CPA. You've got to pass tests. You've got to go to school. You've got to obtain licensure to perform a service or a duty or whatever it is you want to call it. And then they're not performing.
And they're doing the books for businesses that I think a lot of times have very little knowledge of how it's operating. Um,
I,
so I mean,
that's crazy, right? I mean, because like you're a doctor or you're a lawyer or you're any profession, right? You go to school, you study, maybe you change career paths. But if you're a CPA and you're also doing bookkeeping, how are you going to bookkeep for a business that you don't know what's a consumable, what's an asset, what's what's an office expense, you know?
it's the same kind of thing.
Are
Yeah.
we breaking down insurances by professional liability, general liability, workers' compensation insurance, And it's the similar negligence, right? Just like, oh, it fits here, but is it
But
supposed to be
I
there?
still feel like there's more regulation in every other industry except medicine. I don't like
And it's
uh,
the most important industry to be
look
regulating.
at like building codes. Look how strict they are. You know, some people say they're too strict, but they exist for a reason.
I told you about all the stuff I'm dealing with in Vero. With the Romex wiring, I didn't even know what that was. Can't be used in commercial buildings. It can only be used in residential and like ceilings and inside the walls. We had it everywhere. How to get rid of it? Unexpected expense that came into that build out. Then motion sensor lights in the hallways must new building requirement up to code has to be in there for patient safety. He was saying I don't know how it would relate to ADA compliance, but maybe it does a little bit. And so now we had to put
But why
motion
would you
sensors,
need
especially
motion sensor lights if you agree
energy
to have the
saving.
lights on just for energy
I think
saving?
it's based on an energy requirement. Yeah.
I've never been in a practice where the lights shut
Mine
off
and
during the
Jupiter.
day.
Yeah, no, Jupiter's is motion sensor. PSL is too.
So the lights will shut off during the day? In the rooms or in the hallways?
No, in the hallways, they're on timers, or they're not on timers. They're motion based. Like at night, they're off automatically. During the day, they're on because of all the traffic, based off of
Really?
motion. Yeah,
Hmm. I just think with LED
I don't even
lighting,
think I can turn them off unless I hit a breaker. I can't. There's no light switch. There's not.
interesting. I didn't know that.
Um, and they're a pain to change. Actually, God,
Hmm.
really exhausting. But back to medicine. Yeah, no, it should be regulated. There should be boards, there should be regulatory bodies, but I don't think anyone's like talking about it. You know, you see a little stuff here or there, and they
Well,
only
when you think about it, the medical spa industry, wellness industry is the merge of about 3 or 4 different disciplines of medicine. And even when you get into those, like say you're talking about dermatology, right? And maybe plastic surgery and how that intersects with Botox and or botulinum toxin injections and dermal fillers
does
and
it.
well,
So let me
kind of, but not really.
what like for a derm who's dedicated their whole life to dermatology, skin conditions,
No,
massive organ, right? How many things can occur on the skin,
exactly. So I
right? So you
mean, within dermatology, there's the dermatologists that go the cosmetic route,
mm-hmm.
and there's the dermatologists that just want to treat pathology. And I mean, there's plenty of dermatologists out there that don't know the first thing about cosmetic dermatology. So
But
it's
we talked about that. The state wrote that with definitely good intentions, right? So, what other medical specialty would relate closer to aesthetic medicine besides dermatology and plastic surgery?
I think it
None.
was just a lazy approach. I mean, it wasn't well thought out
What would be your
because
approach?
that somebody needs so much experience in the field to become a medical director of
And
that particular body.
and now that there is so much experience in the field, right? Tons, decades of experience in the field, there should be change.
Yeah.
And compliance, people should encourage compliance. People should encourage regulation. You shouldn't be scared of statutes. You should want to learn about statutes because there are so many different boards and regulatory bodies by the state that are well versed in what can be done, what shouldn't be done. Like, I mean, you've got to look into some of this stuff, not just as a provider or a business owner, but as a patient too, right? Is your provider licensed? Do they have a decent understanding in what they're performing? And then don't leave that provider over price, right? Because one, they went through they dedicated their whole life to perfecting this service. There's a significant amount of overhead and cost and consumable and time put into performing that service or procedure. And if it works, stay,
Yeah.
right?
Yeah, it's
They know your
funny.
body. They know your anatomy. They know your history. There's some cool stuff out there though. That I mean, I mean, you've got everything to market right now. If we were to talk about it and dive into it,
Hmm.
think about it. A couple years ago, it's just really Botox, then Dysport, and Xeomin, Latibo, Jeuveau, Daxify. You've got everything out there now.
Yeah.
So it's not just from a med spa perspective. There are so many vendors out there. How many proposals do you get a day?
There's so much to know too. I mean, there's so many new things coming into the market, and just to say like, hey, I'm gonna grab onto some dermatologist that's retired or a plastic surgeon that's never done an injectable in his life. He's gonna be medical director of this med spa that offers 100 services he's not familiar with. I mean, I'm not saying all plastic surgeons don't know a little bit about cosmetic dermatology or cosmetic medicine, but they really focus on surgery, and that's what
Uh,
they should be focused on because that's what pays their overhead.
yes, but also another thing, right? You have a surgeon. What are they doing all day? Well, less their office hours. What are they doing majority of the time?
Surgery,
Okay, so if you have a medical emergency, right? How are you going to get a hold of that surgeon?
exactly. They're not going
And
to
do
be
you think
available.
and do you think you're going to be able to address it right then and there? The whole point of having a medical director is you're supposed to do it with good intent of the patient, which is why a position like yours is
It's
so
supposed to be a
important.
safeguard.
Yes, I mean you should. I mean, you see that I idolize what you're able to do for the providers, right? If anything were to ever occur, or and I'm getting the chills talking about it, if anything were to ever occur, or that they were able to foresee something, they have someone so intelligent that they can go to and that they trust to handle that scenario.
Yeah, and the good thing about instructing someone on what to do in a certain situation that's unique and novel. I mean, if you're not certain what to do, you know what to tell them that the appropriate follow up is, like call 911, do this while the ambulance is coming, etc. Or this person needs to go to this place or see this particular specialist right away, or this person needs to go to the emergency room right away, or this person needs to come in and be placed on steroids immediately and antihistamines, etc. So it's like there's a lot of things that need to be done within a short period of time for a lot of these adverse events that can occur. That can be like a 1 in 10,000 thing, but you just happen to get unlucky that day.
You know what's crazy? Jen and Alex, they came into my office the other day, and they know how to perform it, but they were like, "Can we do a whole office CPR training across all the locations?" I was like, "What? It's like, what are you guys talking about right now?"
Isn't that thoughtful? How
Yeah,
many times
yeah,
are you
so
gonna get that?
correct. But I was like, what, like, and I would kind of like brush it off for a second, but then I sat there and I thought about it for like right after they walked, and I was like, you know what? I can appreciate that, right? Because if something were to happen in a different scenario, right, out of a medical procedure, maybe just in the waiting room, right, and how long it takes to get an ambulance or someone there, the providers are well equipped to handle that. But they were like, we should do, maybe an annual CPR refresher for the whole staff, new employees, everyone in the office should do it. And so I've reached out to a couple companies, but what was crazy is you can just go get a CPR certificate online for like $3.
Yeah, it's crazy.
Just to say you have like a CPR certification.
Crystal teaches that.
Really?
Yeah, she does the basic and the advanced.
She always done that?
Yeah, she does it on the side because she used to be a paramedic. So
We're gonna bring her up.
yeah, I'm sure she would love that.
See, we're bringing her up. That's crazy. I didn't know that she did that on the side. Wow. Yeah, no. So I mean, I thought I was able to appreciate that because you can have a reaction anywhere. It's not just in a medical environment.
Yeah.
So
And it's not just about hooking someone up to an AED or giving someone a shot of epi, or CPR is something that's frequently done incorrectly, and just the basics of that are very important. I mean, obviously you don't need to know advanced CPR like in a hospital setting, but certainly to stabilize a patient the best you can while you're waiting for an ambulance is very important.
if we looked up med spas near me, probably saw like 100 within a 20-mile radius more. How many do you think have an EpiPen in the practice for an allergic reaction? Let's off of 100 clinic basis.
50% maybe?
Isn't that insane?
I don't know
that
though.
we're even
I'm just guessing.
We're even guessing that. Like, we should have the confidence in the industry that 100 out of 100 carry that because it's a regulation. If you will fail inspection if you don't have an EpiPen on.
Oh,
if you don't have an AED,
for
an EpiPen.
biohazard waste, like they inspect you every year for that, and then you have a company that comes in and does it.
Who do you
they
use?
have no
Use Advantage Medical Waste Solutions? Use someone
I
else?
can't remember the name of them.
They're great companies though. They come on like a weekly basis. I think I have them set up on a bi-weekly basis, but no, every 2 weeks because sometimes in the months with 3, you go 3 times in a month.
But I mean, that's what I mean. They have enforcement for fire, for biohazards.
They came by today. Not the fire department, but a company that comes in and inspects your fire extinguishers. They came by today though, inspected, put the new 2025 tags on it, so now it's good through November of 2026. They did all 3. It's like $60. But no one.
There's not even anyone that comes by for these types of businesses and says, "Hey, who's your medical director? Where are they? What's their current? Is their current license up to date, etc." That's all just like you gotta trust.
I don't think it should just be an aesthetic medicine though. It should be for hormone replacement therapy clinics. Like, do you have so many hormone replacement therapy clinics that don't have MDs? Shouldn't be allowed. Should be for just laser-based clinics as well, because electrology is dangerous. Regardless of what anyone says out there, electrology is dangerous. I mean, we've seen the burns that are all over social media.
Yeah.
right? So it's dangerous. If you don't know basic skin types and you're not using the correct modality, the burns can be serious.
Or you have the incorrect settings and the laser. Yes. No, you're right. It should be across the board for pretty much every medical practice, whether it's um, even if it's an internal medicine based practice without a medical director. And that's, I mean, I know they can get away with it, but can it just, I don't know. It
You
doesn't
know,
seem
but
right.
here's the thing though, if let's say you started in internal medicine or something and you went through med school, you did everything, you could still become very knowledgeable in aesthetic medicine.
Hmm.
I don't think it has to do with what type of specialty you're in. I think it has to do with how much knowledge you obtain in the industry you're supervising.
Yeah.
And that also relates to MD negligence too. Like I fully think that there are MDs out there abusing their license to supervise clinics when they shouldn't be.
Oh, 100%. There's also MDs that are doing or seeing patients, not just talking about in the cosmetic and wellness arena, but they're doing they're seeing patients and performing procedures well outside their scope of specialty. So, I mean, I'll give you just a simple example, like an OB-GYN that's doing breast implants.
What? Where have you seen that?
That happens. There's lots of stuff like that happens. Yeah.
That's new to me.
Not just breast implants, but they'll get into all sorts of cosmetic surgery.
And they're just doing it. I wonder how
Because
that.
an
I wonder if
OB-GYN is like
that's
a
crazy.
surgeon, but
Yeah, but if something were to go wrong, I wonder what these malpractice attorneys would do about that.
yeah, it's
Or they're just
bad. It's
personal
bad.
injury attorneys. You got to eat that up, right? I mean, you'd think. I mean, unless what they're doing you're telling me they're doing a fellowship. with
No,
the
I'm not telling the fellowship. I'm saying that just
They just
they
get
roll
into it.
into it. Yeah.
They just kind of whatever.
Mm-hmm.
No, man, that's crazy.
Yeah.
You know, and I think that they know. You know, if people make mistakes, right? But don't jeopardize patient
I mean,
safety.
theoretically, you could have a pathologist that's, a medical director. I mean, I think that's why they wrote that rule, like for derms and plastic surgeons, but it's so out of date now.
Let me ask you something. Why don't you think chiropractors can write medications?
They can't
Yeah, why?
because they realize they have no medical training.
Got it. Dude, there are chiropractors out there who are intelligent in what they're doing, right?
Yeah, but they're not. Their training has nothing to do with writing medications.
Got it. So how do you feel about chiropractors getting into regenerative medicine or wellness
They shouldn't be allowed
from like
to
a
at all.
holistic approach?
Yeah, no, it should be banned. It should be strictly enforced that they shouldn't be allowed to do that. Because they're getting into hormone replacement, they're getting into weight loss,
How?
and they're
You think they just have an MP writing all the scripts?
maybe. I mean, I don't
But
know.
who's supervising that MP? You think they have an MD on board or no?
I don't think so. I mean,
Or DO?
what kind of MD is gonna work for a chiropractor? I mean, I just can't see it. It seems extremely shady. The whole chiropractic industry to me is a little bit shady because they're all getting into all these alternative therapies, even exosome and stem cell and
Yeah, but
they sell all these supplements and homeopathic medications through their facility. Again, it has nothing to do with their training.
what if they pivoted though? What if they what if they started with chiropractic care, right? That's how they started. And then they built a successful medical practice, brought MDs on board, did it the right way with nurse practitioners, PAs, and now they had a medical
I
practice.
mean, if they did it the right way, it's fine.
So
Just
do-
like
do you-
anybody else
yeah.
that would own a medical facility that
Do-
isn't a doctor.
Do you think they're just doing it the wrong way? Like just because they're
Yeah,
Yeah.
I think part of it's ego driven. They think they
But
see themselves as
as a
medical
doctor,
doctors.
as a doctor.
Mhm.
You know,
But
it's,
in reality, it's absolutely no different than any other type of entrepreneur owning a business.
yeah. Well, I mean,
Except
you can have.
they tend to cut more corners.
What do you mean?
a chiropractor because they see themselves as a medical professional in some essence, some imaginary world
Yeah.
that
Not
they
all though, not all,
no, but
but
some
yeah.
that are getting into this kind of other realm of medicine that has nothing to do with chiropractic care. I'm not saying there's not a place for chiropractic care, but it should be a fairly narrow therapeutic window to what you can do.
You know, you could have your doctorate in anything, or you could be a doctor of anything. I
Mhm.
think it's just an like an abused title, right? And within that realm specifically, because it's close to medicine, I think that's where it comes down to. Because I mean, you could
I guess it's just like
all the
dentists.
professors in college are, you know, they have their PhDs in education, they're doctors of education,
Hmm.
right? But no one thinks of it like that. It's just thought about because a chiropractor is dealing with patients. That's what it comes down to. You're dealing with patients.
Exactly. But you don't see that as much with dentists. I mean, dentists do try to get in the Botox and injectable cosmetic medicine, but they're not really branching out into weight loss and other stuff because I think they know they can't really get away with it. But for some reason,
Yeah, but they can call in scripts.
they can.
So like if they
But they
wanted to,
have a
they could.
limited. They do have a limited scope to what they can prescribe. They
Yeah.
can prescribe painkillers and antibiotics.
So like if let's say my dentist wanted to call in a GLP-1, you don't think he could do it?
I don't know.
You think the regulation would advise it?
Yeah, I would. I'm not certain, but I don't think they can.
Yeah, but what if you were dealing with like some sort of
That's outside their scope of practice, though. Way outside.
so how is Botox inside their scope of
It's
practice?
not. That's what doesn't make any sense.
You know, it's just like a
Because they can
continuous
inject
question.
a needle inside the mouth, and they can basically inject any other substance outside the mouth. It doesn't make any sense.
It's so funny. I mean, I don't know, but I could see why a patient would do it though, right? Because you go to your dentist, right? You start talking to him, her, individual. Oh, you do Botox? We do it here.
Yeah.
It's very easy, right? Oh, we could fit you in for injections right now. What are you paying?
And the
$14?
funny
You know, oh,
thing,
we got you for 9.
these are the exact group of people we're talking about that they have their dentists never done a cosmetic procedure in their life, and they will go out and take some 2-hour course, and then the next week they will be injecting Botox and advertising Botox
So why
treatments in
shouldn't
there.
a dentist be supervised?
I don't know.
You know?
It's crazy.
You know, so that I mean, like, why shouldn't a dentist be supervised? Like, why is it just a PA and an MP who need supervision because they had more school with in relation to the
Because
mouth?
they're called doctors, even though they're not
Doesn't that
doctors of
blow?
medicine.
Doesn't that blow your mind though?
Yeah,
So
it's
you're telling me
crazy.
that a PA and an MP who could have dedicated their lives need supervision from a doctor, but a dentist who just decided to get into Botox because it's booming doesn't need supervision?
Yeah, because they can inject lidocaine in the gums.
I could I could almost put my life on it that Jen has 99% more experience than any dentist that's injecting Botox out there. I think you could. I think
Unless it was a cosmetic dentist, and that's
yeah,
like a
that's a
big
little
portion of their
different,
practice. But
right?
yeah,
I think based off of if we were to take a percentage of dentists injecting Botox now, and you took PAs or individuals like Jen who have been injecting their entire life, she would be in the 1%.
but she comes from a different time. Now every nurse practitioner and PA is literally going into that career path to become an injector because it's like
Yes.
the really desirable thing to do now.
What I mean, you know, but
But back then it wasn't like
no.
that.
And you could see why it's
She's a purist.
yeah, I mean, you could see why it's desirable, right?
Yeah.
I mean, you could fully see why it's desirable. I mean, it's the same thing with my mom, right? She's been in electrology her whole life. She's only ever done and known electrology her entire life, right?
Hmm.
So when these providers or these electrologists, facial specialists, they come in and they for new employment, they are not equipped to handle a laser. Zero. I've never seen it ever out of the history of hires in relation to any experience to handle a Candela General Max Pro, to be specific, right? To deal with the skin types. I mean, they go through aggressive shadowing and training for like a month before they're released to see patients. Like, it's intense.
Yeah, so you give your own electrologist more education than most
school.
medical spas give to their injectors that could be have never injected a single patient in their life.
It's the same thing with the schooling, though, right? I mean, and I hate to say it, they're going to electrology school. They should be profound in skin types coming out.
They don't know anything. And so the esthetician really has no knowledge of how to do facials with certain types of equipment.
You have to carry both licenses to work for Refresh. Like, if you're going to be an electrologist, you have to be an esthetician. If you're going to be an esthetician, you also have to be an electrologist.
But they have
as a recommendation,
estheticians with a laser certification as well.
We won't. No, we won't.
What's the difference?
No, you have to have your electrology license. You can do a couple different based like credit hour courses. I see it, and you have needle based hair removal, which is electrolysis, right? Where it's more like a stick and poke method, which is desired for individuals who have gray hair because the lasers can't
absorb.
Yes,
the hair won't
correct.
Absorb the wavelength.
And you have laser-based electrology for utilizing a machine, and then you have both. And every time an individual applies, you would make sure that they would have both those licenses, and after you get through the whole hiring process, you hire the right person off of personality and everything, think they're going to be a good fit. They still go through these crazy, and I mean crazy, long days, long hours, long weeks of shadowing and intense training. And a lot of it's like verbal. Like, let's say it's not even hands-on, right? A ton of it to the end is hands-on, don't get me wrong. But it's like, I mean, she'll go around the office and like she'll cut, like she came in today, she's like, skin type. Then she'll roll up my sleeve. She says, like, what about there? And then she's like, what questions are you asking? And they'll be like, antibiotics. She's like, how long? Because it's photosensitive. And then it's like, what about self-tanners? And what about a tanning bed, right? Because tanning beds are different than natural sunlight. And it's so rigorous just because from patient safety, right? Strictly for patient safety because things can occur. And when a new injector comes in, you communicate with them tremendously, but also with the shadowing of Jen and the trainings we get because of our standing with these companies. I don't think that a lot of these clinics out there are getting the trainings that we are able to obtain because of their relationship with their sales reps and the companies and the volume that they do. Because the trainings are expensive, right? So it's like, if you're an injector wanting to come in, where do you go? What do you do?
I mean, I think it depends on who you're working for, but honestly, it's kind of up to you how much training you want to get. At the end of the day, it's up to the provider because there's no laws on the books. There's no requirements from the boards that regulate these fields. So, I mean, it's basically up to the provider.
You remember Alex when she first started out, and no injectable experience, new hire, and she shadowed and watched and learned for months.
That's the only way to do it.
I mean, months. And then she started seeing patients, right? She eventually cleared by the company, started seeing patients. And she'd have a gap in her schedule. And I'd walk into her room, see how she was doing, still a new hire, reading an anatomy book, facial anatomy, right? Reading about vascular occlusions, reading about the different types of derma fillers and where they go based off of the brands that we utilize. And you could put someone through so much training and devote so much time into an individual, but if they don't do something like that, right, to where they also want it and they also want to learn about it and perfect their craft and care about patient safety, then they're not going to be equipped enough to see patients. You know? I mean, it kind of blows my mind the stuff that I see
There's a
online.
new like we talked about it before, but like the field of laser, like I don't know what you want to call it, photo light therapy or uh,
Who regulates
light
that
based
field?
medicine. I mean, there is so much specialty that goes into that now.
Tons.
If you look at some of these lasers and all the different settings and all the different applications and all the different hand pieces and everything you have to know, there are little doctors out there that's all they do is lasers.
You
It,
make a good point. You know why? Because if you were to put any individual in front of, the Fotona,
have you seen the training books for these lasers?
crazy. I mean,
It is
it's
crazy.
insane. And if you were to put any individual, regardless of the specialty, that didn't know about lasers in front of the Fotona, the G-Max, the Tetra, Helix, whatever you're utilizing, said treat this patient based off your medical knowledge.
No,
It's
it'd be like fixing a car.
yes, but
It's
you're
like such a
dealing.
different thing.
But you're dealing with a human life.
Yeah.
You're dealing with a human life. That's the difference, right? So where it's like, and you have to obtain a bunch of license. You have to be a mechanic to work on a car.
So tell me though, I'm curious. The the company that sold you the Toro,
Yeah.
that's Deca?
No, Cartessa. Well, Cartessa Aesthetics so it's a little weird the way they do it. First of all, love the company. They're great. Anytime we have an issue or a question, well, I'm gonna be honest, not all departments, but Dave, who's our representative, he's incredible. He definitely makes it a lot easier to get around in terms of like navigating the fields and within the company, right? They only have so many trainers, so it's like
Uh-huh.
you have questions about certain things and settings and modalities. He coordinates it all, right? The trainers sometimes they don't get back to you, and he's equipped enough to get you in the right direction. So kudos to him. But they back to your point, they're like a distributor of Deca.
Okay.
Right, so Cartessa Aesthetics is a distributor of an Italian-made manufacturer, which is Deca.
Okay. You're telling me even they don't know what the requirements in Florida are? I
No.
mean, normally the company that sells the equipment would know.
What about the
Like
hyperbaric
you
though?
need a
You have the
you
same
need
thing
a
with the hyperbaric though.
I know what
Same.
the requirements are.
Yes, you do, right? But the hyperbaric company. Well, I told you about this. We had a massive discussion about this. What did they when I had questions based off of protocols, company protocols, and I don't want to name the company when I was in the process of buying hyperbaric chambers. Like when we were exploring all the different avenues, I was exploring different companies. What do they claim to be? An engineering company.
Yeah, basically a equipment builder.
And I just think it's because now they need a regulatory body,
But they know
right?
that I don't think they can sell to non-physicians, can
Okay,
they?
but here's the thing, though.
Because in Florida, I think you need a physician associated with hyperbaric treatments.
You would think
Because
that.
there's a whole field of medicine called hyperbaric medicine.
You would think that, right? And I don't know. Like, I
Well,
mean,
that's what they told me when I bought my hyperbaric chamber.
did you have to sign off on
But there
anything?
are other.
Did you have to sign off on anything with the purchase of the hyperbaric? For me, for my hyperbaric that I just bought,
No,
nothing.
you're right.
You see what I'm saying? So maybe they just like look on the website. They're like, oh, he's got 4 doctors. He's equipped.
That shouldn't be sufficient. They
No,
should need
it
a
should.
doctor's signature.
It should not be sufficient, right?
Yeah.
Shouldn't be sufficient. And it's like, what if there was malintent behind it, behind the the purchaser, right? Where it's like you're not going to collaborate with your physicians. You don't have a good partnership with your physicians or your providers, and now you just have a hyperbaric. I know so many practices in the area that are just like they sell just hyperbaric, and I can't find a physician near them.
They need a physician on site, though, don't they?
I don't know, man. I mean, you would, but here's the thing, though. I think maybe it's based off of the atmospheric pressures, right? Because you can go up to X atmosphere, like yours goes up to 3, but you can get a portable at home hyperbaric chamber. So then that's unregulated, right?
Mm-hmm.
Right. And what do those
But
go to?
I still thought that you need a
atmospheres?
prescription for those.
You do.
Okay.
No, you should. You should have 100 to actively have.
Like, can you purchase it without a prescription?
Maybe like go online right now. I'm sure you could buy a hyperbaric and put your credit card right in. But I think the way it's supposed to be done is you meet with the provider, they deem it medically necessary, give you the script, perform your treatments based off of your condition, right? I mean,
And that way, you also can get away without paying tax if that's the case.
what do you mean?
If you have a prescription for a medical device, you don't have to pay tax on it. For example,
What?
yeah, because like medically medical
Necessary necessity?
yeah,
Got it.
a
Yeah.
medical necessity
Okay.
can't be taxed. So, for example, if you got to buy a sleep apnea machine and you have sleep apnea and you got a physician prescription for a sleep apnea device,
Yeah.
they can't tax you on it.
Well, we don't tax anything. You don't
No,
tax
but
anything.
when you buy it from the manufacturer, with the patient, so the patient's going to a medical supply place and they're buying a sleep apnea machine.
They're not being taxed.
Exactly.
How are
But
they,
without a
though?
prescription, they would be.
Yeah.
Same with there's cold plunge. If you write a prescription for a cold plunge unit, say, I don't know what criteria you would use, but let's say they suffer from lots of inflammation and lots of injuries, they don't have to pay tax on a cold plunge
I
unit.
didn't know that.
It's a way to get around. Some people do it without get around paying taxes on certain things
You
that
know
are medical.
You know what's crazy? I mean, I know personally, I know clinics and I know there's sales reps that are selling clinics all
Mhm.
across the state devices that need to be done by certain individuals, and they're not. And they know they're not. I mean, you go on their website and look, and it's just not there. The providers to be equipped to be doing those procedures.
But when you bought this Toro,
Yeah.
you didn't need anyone to sign off on that?
No.
Really?
No. Dude, what do you mean? Did you sign
I mean,
off on
that's a
that?
pretty serious
None of the
device.
other doctors signed off on it. I would go, I mean, you're the CMO. I would go
Yeah.
to you.
That's crazy.
So, I mean, here's the thing, though. I don't think the Toro is as serious as the Deca or the Helix. The Deca and the Helix are way more serious
Well,
than the Toro.
I mean, you
You
can
see what they're doing. I
yeah.
mean, it's crazy. They go very, very ablative, right? And no, no physician needed to sign off on that. However,
I
if
could have swore when I bought the Fotona, there was all these medical requirements.
How
They asked
long
for the
ago-
medical license.
how
and all
long
sorts
ago
of
did you
stuff.
buy that?
Like
I
3 or 4
can't-
years ago.
You know what's funny? I can't remember the last time that I've had, unless this actually applying for HCCE permits, the healthcare clinical establishment permits, or applying for electrology facility licensure. Right, those are the two main ones. Tattoo establishment. We hold the tattoo establishment. Personally, I don't. I think microneedling. This is going to be a sensitive subject. Microneedling, you're piercing the skin, right, with a needle, right? Multiple incisions, just like a tattoo. Even though you're not using permanent ink, you could be using plasma, vamp, whatever it may, exosomes, whatever you may be utilizing topically. You should hold a tattoo establishment license, and the provider should also hold a tattoo license. We require that. We require it. So the facilities are tattoo establishments. They also have tattoo establishments. I think it's a good safety net. I mean, they come in, they inspect, they're like, I mean, there's some serious stuff that goes into it.
Why don't you do cosmetic tattooing?
No,
Why?
like permanent makeup. I mean, that's like a
That's not-
chiropractor getting into wellness.
No,
Yes.
it's a cosmetic thing.
Yeah, but we're a medical practice. We're not cosmetologists.
But if you have people, for example, you're talking about
like permanent
reconstructive
browns,
plastic surgery,
Yeah.
where you're restoring the areola, or
How
a
common?
person has a severe lip
It's not
scar.
common. It's uncommon.
I don't. There's a lot of people looking for it.
You think? Why don't
I'm
you
not
do it?
talking about permanent.
So why
makeup.
don't you?
I'm talking about
Why
more,
don't you do it?
There's so many. I mean, you.
Why don't you do it? Same
never,
reason.
Just never had the time to get
Exactly.
into it.
Never got into it.
I think there's a demand for it though, because it's hard to find a good cosmetic. I think the plastic surgeons would be more associated with people like that.
Do you think those individuals should be supervised by a MD?
Mhm.
They're not. Let's go to a permanent makeup specialist and let me know if they're.
I feel like they should though.
You think they are though?
No,
No.
they would be just considered tattoo artists.
Exactly. I mean we can talk all day about it. Regulations and supervising individuals and adequate individuals in the realm, but the whole purpose of it is just to care about your patients and their safety. I mean, you shouldn't be performing a procedure you don't think you're equipped to do, right?
That's correct.
all the providers are, I mean, every single training I get, when I ask, they're like, yes, please, please. No matter how much experience, how old, how young, how little experience, they're all ecstatic to always keep going to trainings. You asked me to go to A4M in Vegas, not just because it's Vegas. I mean, we went to the A4M here.
Mm-hmm.
You've been practicing forever. You still want to go to A4M.
Yeah,
It's the same
because there's
continuing
always something that
education.
you might find that's valuable, not just a
The
new product,
hyperbarics, we
but
found the hyperbarics
mm-hmm.
there. I mean, they're a great company, and they had some serious knowledge around oxygen-based therapy, oxygen-based medicine. What's crazy though is back to the permits, the HCC, electrology, all that stuff. We got off track. Uh, Outside of that, I don't remember the last time that I had to, when setting up an account, send a physician's, one of the doctor's license, or like one of the practitioner's license.
Well, all the injectable companies want it.
That's it though. Not the device companies.
The
I don't.
pharmacies, the compounding pharmacies, and the cosmetic injectables. But yeah, you're right.
No,
As
I'm talking
far
about
as
the device companies though.
yeah, the
When's the
device.
last time you bought a device and had to give your license?
Mhm,
Can you remember? I can't.
mhm,
And you know what's crazy though is we have tokens installed on the providers' phones for prescribing controlled, so they
mhm.
can authenticate it.
Yeah.
Should be the same thing for GLPs.
Well, I mean, if you're going to say
It
that
should be
should
the
be for
same, and it
GLPs,
should
but
be
it
the
should
same
be
thing
for every medication
it's,
then.
for compounding pharmacies in specific, right? Should be a requirement. People are
Because yeah, there is way too much abuse of compounding
so
pharmacies.
much abuse, right? It's different when you're prescribing to like
There's these clinics in Miami,
it's
and I don't even
nuts.
know. They're like hair salons or they're nail salons, and they're literally dispensing GLP-1s out of the back.
Because
Uh,
if what do you need? You need an MPI. You need a
they don't
D.
even, they get it from somebody.
It's just
They'll get a massive, huge bulk shipment of GLP-1s from whatever pharmacy. And yeah, you're right. I mean, they're when it comes to compounding pharmacies, because there's so much fraud and misuse in that industry. I think it should have secondary authentication on those prescriptions.
it's so important. It's like my favorite thing, at least with controlled, right?
Hmm.
I love that they have it because if any like you don't call in your own scripts. Crystal does it, right? You tell her to do it and she does it,
Yeah, for
right?
non-controlled, yeah.
Yeah.
But I'm involved in every controlled prescription.
Yes,
Yeah,
and non-controlled, but you still, she's the one who goes in there electronically and describes it, right?
most of the time, yes.
Now, it's the same with not. I would say it's the same with a lot of practices who have multiple providers. Jen, Alex, all of them, they write the script. One of the nurses or admin staff
We'll
goes
submit it.
in and submits it for them,
Hmm.
right? They fact check everything, they make sure it's correct, and then the script is pushed through. They're fully involved, but someone else is assisting in the typing of it, right? The actual input of the medication,
Mm-hmm.
even if it's to a regular pharmacy.
Hmm.
Dual authentication should be required, my opinion, so that there's no abuse and so it limits abuse and negligence. Also, there's a lot of practitioners out there and providers who have probably worked for a practice that has abused their license, right? Called in prescriptions that they're not aware of. It would limit that. It would probably eliminate that, right? Because they have to authorize it.
Yeah.
You know, I think it
I
would.
mean, but theoretically, I mean, you could set up a soft token for anybody.
Yeah, but it would
If
help.
the
I think it would.
doctor's okay with it, I mean, they can basically say it's not supposed to be done that way. Don't get me wrong,
What do you
but
mean?
I mean, it's just the authenticator is just an app on your phone, right?
Yeah, but
You can register the credential ID for that authenticator
on a different phone. But
on
then that's negligence on the provider. That's different, right?
yeah.
But it limits the malintent of other individuals doing it behind a provider's back.
Hmm.
In my opinion, I think it's important. I think it would be good because how there's 100 million compounding. Let's see if there's more compounding pharmacies than McDonald's out there. What do you think the odds of that are in the state of Florida?
No,
You
too
don't
hard, but I mean, there's probably more compounding pharmacies in Florida than any other state.
pharmacies in Florida. This McDonald's stat is just going crazy. No single current figure of the exact number of compounding, but 4,500 licensed pharmacies. 950 of them are considered high risk compounders.
Oh, really?
That's insane.
950?
25%
Well, that's hard to believe. 950 in Florida?
are considered high risk. Of those 950, were identified as high risk compounders, while the rest primarily handled lower risk activities like capsules or lotions. That's insane. I don't know, but I mean, we could really dive into all these different regulations, but I guess we'll save it for next episode, right?
Oh, yeah, right time.
Thanks for tuning in to Inside Out Med.
All right, thank you.
We'll see you next time.